go.
Hello, my name is Crystal Logue, and I'm a registered nurse here at Dr. Joe Smith's office. Today I'm going to be performing a full head-to-toe assessment with your consent, and I want to make sure that I provide you with as much privacy and dignity as possible. Will that be okay?
Yes, ma'am.
Okay, I'm going to go wash my hands and I'll be right back.
All right, thank you. In the corner, in the corner. Stay in the corner until she walks by.
Alright, I'm just going to ask you a few questions.
Mm-hmm.
Do you happen to use an assistive device when you ambulate?
No, ma'am, I don't.
Do you have any trouble speaking?
No, ma'am, I do not.
Do you have any trouble hearing?
No, ma'am, I do not.
Okay. Well, as you can see, this patient has good personal hygiene. She's come in with her hair brushed today, her makeup on, and her clothes are clean. And she actually has a good affect. She seems to be compliant and appropriate for now. I'm going to go ahead and check your vital signs, okay? I'm going to check your blood pressure first.
Yes, ma'am.
And I'm going to check it in the left arm. Is there any reason why I can't check it in this arm?
No, ma'am.
Okay. Okay, just relax and uncross your legs. Alright, this is going to get a little tight. (108/64). That's a really good blood pressure. Okay, I'm going to check your pulse, which means I'm going to use my stethoscope and I'm going to touch your wrist at the same time. So I'm going to have to use this right here. Let me move your hair. Okay, your heart rate's 72. That's good pulse. And your respirations are 17. Now, if you will follow me, we're going to go over here and check your height and weight, and then we'll be done.
Okay.
If you'll just step on the scale.
Okay.
Okay, you can step back.
Mm-hmm.
And then I'm going to have you put your head back. I'm going to take the glasses off. Okay. You'll just lean your head back. Okay. I'm exactly 5'4". Does that sound about right?
Mm-hmm.
Okay.
All right.
All right. That's it. I'm going to ask you some more questions. Can you tell me what your full name is?
It's Jane Doe.
And when's your birthday?
7/11/53.
Can you tell me what today's date is?
Friday, November the 20th, 2015.
And can you tell me where we are?
Brunswick, Georgia.
Okay, as you can see, the patient is conscious and alert, and she's oriented to person, place, time, and purpose. I'm going to go ahead and start my assessment. I'm going to take your glasses off because I'm going to have to look through your hair and your scalp. And we're going to start from the head and work our way down, okay?
Okay.
All right. I'm just going to see if I feel any bumps and make sure everything is round and symmetrical. Do you have any tenderness when I do this?
No, ma'am, I do not.
Okay. All right, I'm going to feel right here on your face if you'll just look up at me. Okay, I'm going to check your sinuses. Do you feel any pain when I do this?
No, ma'am, I do not. No, ma'am.
All right, go ahead and open your mouth and shut your mouth. Did you have any pain or tenderness there?
No, ma'am, I do not.
Okay, thank you. Okay, I'm going to go ahead and check your eyes. If you will, just look straight at me. Keep your head straight. All right, I'm going to have you trace my pen. Keep your eyes straight on the pen and your head straight without moving your head. Just move your eyes. All right, good. All right, I'm going to go ahead and inspect your face and your eyes. Eyebrows are even. Eyelashes are evenly distributed. Okay, I'm going to have you look up. All right. Mucosa is pink. No issues there. All right. I'm going to go ahead and use the ophthalmoscope. Turn it on. I'm going to check the sides of your eyes. Cornea looks good. The irises are flat, regular color. All right. All right, I want you to look straight. I'm going to follow you with my light. All right. There was a red reflex noted, and there was no dark shadows or black dots observed. This assessment indicates that cranial nerves 2 and 3 are operating within normal limits. Okay, I'm going to go ahead and check your ears. Everything looks symmetrical and no discharge or anything seen. No redness or swelling. Do you feel any pain here?
No, ma'am, I do not.
Okay. I'm going to go ahead and check you with my otoscope. Okay, the eardrum is shiny and pearl gray with the cone of light shown at 7 o'clock. Alright, this eardrum is shiny and pearl gray with a cone of light indicated at 5 o'clock. No drainage or discoloration, no redness or inflammation noted. Alright, we're going to do a hearing test. I'm going to come behind you and whisper some things in your ear, and you're just going to tell me what you hear, okay?
S2.
Yeah.
8M6.
Alright, as you can see, the patient passed the hearing test. This indicates that cranial nerve 8 is operating within normal limits. However, I will not be performing the tuning fork test as it is no longer indicated as a test for hearing. Alright, I'm going to go ahead and check your nose. Everything looks symmetrical. No lesions or bumps noted. I'm going to have to use my speculum. Okay, I'm going to look in the right there first. Alright, if you'll tilt your head back. Oops, sorry. Okay. Can you step inward for me? This one? Do you normally have any trouble smelling or tasting your food?
No, ma'am, I do not.
Okay, as you can see, that cranial nerve 1 is operating optimally because she has no trouble with her smell. Alright, I'm going to go ahead and inspect your mouth and your teeth. Let me get my gloves on.
Okay.
Alright. If you'll just close your lips together. Okay, everything looks good. The lips are pink and dry. Okay. Alright. If you'll just let me look right here, relax a little bit. The buccal mucosa is pink and moist. Okay. Alright, the teeth are white, evenly separated. The gums are pink. No decay or debris noted. Look at the palate. The palate is intact and pink. Okay. Alright, stick out your tongue. Okay, I'm going to move it to left and right. No white patches or lesions or nodules noted. Okay. Alright, and then I'm going to check your gag reflex. Go ahead and stick your tongue out again. Okay. Okay. The gag reflex is positive, showing that cranial nerves 9 and 10 are operating, functioning just fine. Alright, stick out your tongue. Say ah.
Ah.
Okay, the uvula is midline and intact and rises appropriately. And the tonsils are grade 1. Okay, I'm going to go ahead and check your neck.
Okay.
If you'll go ahead and pick up that bottle of water.
Okay.
And just sit straight. No masses or pulses seen at this time. Go ahead and check your lymph nodes. Cervical lymph nodes are soft and non-tender and easily moved. All right, if you'll go ahead and take a sip of water. Tilt your head back and swallow for me. All right, the thyroid tissue is midline and soft. It moved up when she swallowed and then back down to the resting position. All right, if you could go ahead and take a deep breath in, let it out, and then hold it. Okay, do it one more time. Deep breath in, out, and then hold it. All right, no bruise heard. Carotids are just fine. I'm going to go ahead and get you to push my shoulders. My hands up with your shoulders.
This one?
No, push
Right.
my hands up with your shoulders.
Right.
Okay, there you go. Try it one more time. Okay. All right, you have good strength. Now I want you to actually turn your chin down to your chest and up. Turn your head left. Turn your head right. Okay, try to touch your left ear to your left shoulder. There you go. Now the right ear to the right shoulder. Okay, you have full range of motion, and this suggests that cranial nerve 11 is functioning and working just fine. All right, we're going to go ahead and check your thoracic region. I'm just going to pull your shirt to where I can see what's going on here. All right, the skin looks good and tight, no lesions, a few freckles, and some moles. All right, the shoulders are symmetrical along with the muscles. I'm going to check for lung expansion. All right, if you could go ahead and take a deep breath. And out. One more time. Okay. The thumbs move as expected with lung expansion. I'm going to check your lungs. If you'll take a deep breath in. And out. In. And out. In. And out. In. Out. Okay. I'm going to feel your spine. Lungs are clear in all lobes. The spinous processes are straight and non-tender. All right, I'm going to check right here where your kidneys are, okay?
Mm-hmm.
Tell me if you feel any pain.
No, ma'am, I do not. No, ma'am, I do not.
Okay. Alright, if you'll turn around, I'm going to go ahead and mimic the breast exam. Okay, normally you would probably be lying down, but you can always do this in the shower yourself. Alright, you're going to use your fingers and you're going to start from the center of the nipple and you're going to move your way around as you feel for any lumps or any nodules that shouldn't be there, and you're going to keep working your way around, and you're going to go to the center of the sternum and up through here and down through the armpit and the axillary, and you're going to feel up through the arm. Make sure there's nothing swollen or tender or hard that's immovable. And you're going to do it to the other side. Same thing again, starting in the nipple, moving your way around. And you're just going to keep doing that all the way up under, up here on the chest and down in the sternum, all the way to the armpits, around the arms, and then that's it.
Thank you very much, ma'am.
Okay, all right, we're going to go ahead and I'm going to assess your heart, and I'm going to be using my fingers to palpate, and then I'll be using my stethoscope, okay?
That's okay, ma'am. Thank you.
All right. I'm just feeling the precordium area down to the apical area. Okay, I can feel the apical pulse in the fourth intercostal space. All right, now we're going to listen. I'm going to listen to the heart in two different areas. Start in the aorta area. Okay, I'm going to go to the mitral area. Okay. If you'll turn your head slightly to the left. Okay. And just listen for the S1. Okay. Regular rhythm and rate. Sinus tach, and it's 80 beats per minute. All right. Okay. I'm going to go ahead and check your armpits and your upper extremities. Okay, so if you will open your right arm up. Do you have any tenderness here?
No.
Okay, now the left arm. Well, I guess this is your left arm. Yeah, did I got it right? Any tenderness here?
No.
All right, no masses or tenderness felt in the axilla. And I want you to push up against my arms again. All right, there you go. And I want you to stand up. Take your arms, put them out like this. High up as you can go. Back down. And then I want you to raise them up in front of you, and then behind your head, and then back behind you, kind of like a soldier. There you go. And you can go ahead and have a seat. Any pain or discomfort when you did that? All right. Make a fist like you're, okay. Now try to push this hand away from your body. Okay. Now pull it back towards your body. All right, same thing with this one. Okay. All right, and let me hold your wrists. Now try to flex your hands up and back down. All right, now try to push my hands away from you. All right, good. So as you can see, the patient has full range of motion and her upper extremities have normal strength. There are no issues here. All right, now I'm going to be checking your abdomen. I'm going to be looking for anything that doesn't look symmetrical or that may look uneven.
Okay.
Have you been having any pain?
No, ma'am.
Okay, everything looks good. Let's find your umbilical. Okay. The umbilicus is midline. The skin is warm and dry.
You can pull my shirt up. I don't care.
No lesions noted, no redness or swelling. I'm going to go ahead and listen to your bowel sounds. All right, we're going to start in the right upper quadrant. All right, bowel sounds are active and there were no bruits heard at this time. Okay, right now we're going to figure out how to palpate for the liver, spleen, and kidneys, as well as the aorta. Are you ready?
Yes, I'm ready.
Okay, I'm going to move this hand over just a little bit. And in order to do the light palpation, you're going to use 4 fingers, put them together firmly, and you're going to actually push down only about 1 centimeter deep, and you're going to actually move from the right upper quadrant in a clockwise motion, and you're not going to drag your fingers. And you're just going to be feeling for any rigidity or any guarding. Let me know if there's any tenderness. None?
None.
And each time you just move to a new location, and you can determine if there's any voluntary or involuntary guarding. And there's none felt. All right, now we're going to do some deep palpation. With the deep palpation, you're going to push down about 5 to 8 centimeters. And if there was an obese patient, then you would use 2 hands, as well as making sure that the bottom hand stays relaxed, and you would use the top hand to apply more pressure. Luckily, she's not obese, so I can just go ahead and continue with 1 hand. Now we're going to start with the liver, so we're going to go in the right upper quadrant. I'm going to take my left hand and put it under her, and then I'm going to use the right hand. If you will take a deep breath in, I'm going to push down. There's no masses or unusual size noted in the liver. And then for the spleen, we're going to go over here to the left upper quadrant, and I'm going to place a hand behind her. And for the spleen, you really shouldn't be able to feel it unless it's about 3 times larger than the normal size. But we're going to have her take a deep breath in, and I'm going to push in and under the rib cage, and I don't feel anything there, so we're good. Next, we're going to be checking for the kidneys. And you're going to make a duckbill with your hands. You're going to come onto the right side to the plank. Take a deep breath. And you're going to push in to feel the right kidney. Alright, everything feels good. Now on the left side, you shouldn't even be able to really feel the kidney, but you can check for it anyways. And you're going to bring your left hand around behind her and then push down with your right hand. Take a deep breath in. Okay. So I think everything feels pretty good. And now we're going to check for the aorta. You're going to find the umbilicus. And you're going to take your thumb and your finger on your right hand and go to the left of the midline. And you can feel the aorta right through here. And that's it. Alright, now we're going to be feeling the groin for the femoral artery and the femoral lymph nodes.
Okay.
Alright, we're going to feel for the ligament, and then just below the ligament, you're going to push down firmly and then slowly release so you can feel the artery. Make sure that it's normal. And if it was weak, then we would actually use our stethoscope to listen for a bruit. Now we're going to palpate the inguinal lymph nodes. If there are any, they should be small. Do you feel any tenderness through here? All right. They are movable and non-tender.
Okay.
Now we're going to be assessing the lower extremities. As you can see, the skin is warm and dry. There's no lesions. There's no redness or swelling. The hair is evenly distributed. There are no varicose veins. I'm going to check the pulses. Here we are feeling for the posterior tibial pulse. She's good in the right leg. Good in the left leg, and now we're going to feel for the dorsal pedal pulses. All right, everything is strong and regular. Now we're going to check for edema. All right, she's a +1. Do you have any tenderness here?
No.
Okay, now we're going to check for your range of motion. I'm going to start with the right leg.
Okay.
All right, I want you to pick your whole leg up towards the ceiling.
Okay.
Now bend your knee. All right, now we're going to actually bend it out and in. Straight down. This one, left leg. Straight up to the ceiling. Bend. Out. Then in. And straight down. All right, now I want you to push your feet down towards the floor. Pull them back up towards you. I want you to turn your feet into each other, away from each other. We're going to check for your strength.
Okay.
I want you to try to pull my hands towards you with your feet and away. Okay, try to push my hands up towards the ceiling. Lift your legs straight up. There you go. All right, now I want you to try to push my hands away from your knees. There you go. Back down. All right, try to open your legs. Now try to close them. All right, so you have good strength and good range of motion in your lower extremities. Okay, now we're going to check your strength and your range of motion. First, I want you to walk around that chair and then stop as soon as you get back towards me. Okay. And I want you to walk away from me, turn around, walk on your heels, walk towards me on your toes, stop. I want you to try to bend down with your knees and then come back up. Okay. Did you have any pain or any tenderness?
Mm-mm.
All right. Now, if you will, turn around. Bend over and try to touch your toes. I'm just checking your range of motion, checking your spine, looking to see if there's any unnormal curvatures here. Okay, you can stand back up. Turn around and face me. I want you to close your eyes for 20 seconds. You're counting too fast.
It's okay.
All right, so do you feel dizzy?
No.
Do you feel lightheaded?
Mm-mm.
Like you're going to faint or pass out? All right, good. As you can see, she has normal range of motion, pretty good strength, and she has no abnormal curvatures on her spine, and she can follow commands pretty good too. Now we're going to be doing some of a neurological assessment. I'm going to be using this pen to run it across the bottom of your feet.
Mm-hmm.
All right, put your toes towards the ceiling. As you can see, she has a negative Babinski reflex. Next, we are going to have you sit up.
Okay.
All right, I want you to take your 2 fingers, touch my 2 fingers. Do it again. Out this way. Do it again. Okay, now close your eyes. Let me hold one of your hands. All right, I want you to tell me which direction I'm pointing your finger in, okay?
Left, right, up, down. Right, left, up, down.
Okay. Now I want you to keep your eyes closed, put your hands out to your side, take your right hand and touch your finger to your nose. All right, and back out. And then your left hand, touch your finger to your nose. Okay, as you can see, the patient has a good sense of fingers. She'll be able to recognize which direction she's going in, even with her eyes closed. She's able to touch my 2 fingers with hers and touch her finger to her nose. All right, we're going to continue with some of our neurological testing. I have 2 different objects, and I want you to put these in your hands, close your eyes, and then you tell me what they are. Can you feel for them?
That's a penny.
Okay.
That's a bobby pin.
Okay. As you can see, the patient has stereogenesis. I want you to take your hands, palm down, pat your knees lightly at the same time. Okay, then turn your hands over and pat your knees lightly. I want you to take your heel and run it down your left shin, and then take your other heel and run it down your right shin. The patient has good rapid alternative motion, and she has good cerebral function. Okay, now we're going to continue with some of our neurological assessment, as well as your ability to feel things through your skin. I want you to close your eyes. I'm going to run some things across your face, and I want you to tell me when you feel it. Just say now.
Now. Now. Now. Now.
Okay. I'm going to use something else, and I'm going to put it on some areas of your skin. I'm going to start at the head and work my way down to the feet, okay?
Okay. Now. 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 Now.
If at any time it hurts, just let me know.
Now. 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 Now.
Okay. Now we are going to check some more reflexes. All right, I want you to tell me if you feel this.
Yes.
I'm going to use an object and you tell me which end I'm touching you with, either the dull or the sharp end, okay?
This one. Sharp. Dull. Sharp. Sharp.
Okay.
Dull.
All right.
Did I feel that?
Yeah, you felt it. As you can see, the patient has a good sense in her hands, feet, face, and her legs. All of that is within normal limits. She doesn't have any superficial pain when she is being touched, and she is able to tell the difference between sharp and dull, as well as feel vibration on her bony prominences. Okay, we're going to finish the assessment up. This is the last piece of the neurological assessment. So if you will, just let me hold your arms out like this. Relax. Turn it inward or outward a little bit. Okay, I'm going to check your reflex. Normal. Normal. All right, here's your knee. Just relax your feet a little bit. Can you sit back towards the chair a little bit more? Okay, there you go. Normal. All right, I want you to relax your leg onto my hand. All right. Relax your leg. All right, normal. Do you have any questions?
No, ma'am, I don't. You did a very good job. Thank you.
Thank you. As you can see, I did not find anything significant during this assessment, and I want to thank you for your participation.
Thank you.